Hello, welcome to another episode of Yummy Data Science. In this episode, we are going to be continuing our discussion on healthcare claims, and today I'm going to be focusing on pharmacy claims. And just to make this very clear, when I say pharmacy claims, I'm talking about the stand-alone pharmacies only. So these are the CVSs inside Target, the CVSs, the Walmarts, anywhere where you go and pick up your medicine like it's a point of sale, as opposed to when you are in the hospital as an inpatient and you get medicines that way. So discussion is about standalone pharmacies only. And as I've mentioned, this is point of sale data, and pharmacies were one of the first to adopt electronic transmission methodology. And as a result, their data is one of the first elements to come in when we're talking about healthcare claims. And so if you've got your analytical hat on, you're probably thinking, what's the first thing we know about a patient after he has had an encounter? And a pickup at a pharmacy is also treated as an encounter. And if you guessed it's a pharmacy encounter, you're absolutely right. Pharmacy claims and come in the fastest, and so may give you an early warning or early signals as to what's happening with the patient. And I'm leading an initiative. I'm working on an initiative on this, so I'm not going to say any more about it. Then that pharmacy is an important early signaling. From the perspective of what's going with the patient, whether it's complications or harbinger of what other encounters to come. So in this data, we also have a prescriber ID, and that's the physician who prescribed the medication. Um, then there's a service date, the date that the medicine is picked up. And there are many cost amounts. So, for example, packaging and dispensing fees, drug cost, ingredients cost for those drugs that are compounded. And if you don't know what that means, it's simply are the drugs put together at that pharmacy? And that would mean they're compounded. And if it is a compounded drug, then instead of thinking about a total of drug cost, you're thinking about the sum of all the ingredients. Then another thing is that you might see negative dollar amounts in these cost fields. And that's because if a prescription is not picked up within 7 days, there's a federal pullback rule that the pharmacy will put the medicine back, and then the claim will automatically be reversed. So you'll see a claim with the positive dollar amount, then you'll see another one with the negative amount backing it out. So that's what it is. So, okay, we talked a lot about that it's a pharmacy encounter is picking up a drug. Okay, what drug is it? Well, there's the NDC code, the National Drug Code, and the FDA maintains the NDC directory. It's a 10-digit format, and it's broken up into 3 segments. There's a labeler code. Who created this? Who manufactured this drug? So, for example, 0025 is dedicated for Pfizer. Then there's a product code. So that could be Celebrex 1520. And then there's a package code. So the product is inside a capsule, or is it a capsule or a tablet, and how many? And so that would be 100 capsule bottle for this example. And the FDA maintains this NDC directory, and there are daily updates to this. There's so much activity going on. And many companies, including several that I've worked with, have set up ingestion routines, smart ingestion routines that go to the FDA site and they get the daily updates and integrate that with their data. Now, CMS has its own implementation of the NDC format, and that's an 11-digit format. And the only reason it becomes important here is that we are using synthetic data, synthetic claims data from Medicare. So it's important to note that Medicare has its own format. And as you've probably guessed, like if we have a labeler, product, and package, it's hard to compare drugs with each other. So now we're going to come up with two different methodologies which do make it easy to compare drugs with each other. So the first one is generic product identifier, and the second one, which I have put in this box over here, is the therapeutic class codes in 4 tiers, and this is the American Hospital Formulary Services therapeutic class code, and it's basically a way of grouping things into 4 different tiers. And you'd start from the top, like central nervous system agents, and the fourth one example would be serotonin modulators. So I'm not going to talk about the therapeutic class codes. Instead, I'm going to talk about the generic product identifier because that's what I'm most familiar with and have used extensively. It is owned by Medispan, which is a commercial company, and it identifies all drugs, branded generics, and it groups them into hierarchical therapeutical classification system. GPI, the generic product identifier, is composed of 14 characters and broken out into 7 2-character couplets. So, for example, you might have a drug group, and that would be antidepressants. Then, after the drug group, you might have a drug class, and that would be tricyclic agents, and so on. So, you've probably guessed, like, oh, I could take maybe GPI 2, or maybe GPI 4, or maybe GPI 6, and I could then aggregate like drugs together. And so you're probably thinking, okay, I've got this NDC code, I've got the GPI code. How do I find a crosswalk? Well, you can obviously buy it from several commercial companies, but short of that, short of buying it, you can also get it from Odyssey. And this is, I've put it in this call out here. It's OHDSI and stands for, I've given it in this footnote, Observational Health Data Science and Informatics. And it's an international consortium. There's so much wealth of information here. It's an international consortium that is dedicated to bringing out the value in healthcare from healthcare data through standardized healthcare analytics. And what they've created is these standardized dictionaries or ontologies, and one of them is RX norm. And what you could do is you could go to their data model. It's called OMOP, OMOP data model. You could download RX norm, and then you could get a mapping between NDCs to RX norm and RX norms to GPI. And this is very useful if you're doing any pharmacy analytics. And again, I mentioned I'm currently working on a project which does which deals with the specific data. Thank you for listening.